I would like to ask your permission to use this video for educational purpose and on the internet. Tell me about your story, about what you went through. Tell me about it.
Well, it's just I've been dealing with this for quite a few years.
What is it
And
what you're
it's-
dealing with?
It's
Explain it.
leg pain and not being able to do certain things. I was a full-time mechanic. I quit that because I just couldn't do it no more.
Yeah. How long has it been going on? How many years?
Severely for 5 years.
5 years. Now, last year you got a surgery. What kind of surgery did you get?
Laminectomy.
You got a laminectomy L1 to L3.
Yeah.
And that would correspond to the location of the pain. Can you show us where the pain is in your legs?
Right here and down here and
In
then
front of the thigh? Yeah,
Yeah.
that corresponds to that. That's exactly where those nerves are in the L1, 2, 3.
here, yeah, and then it felt like I'm on gabapentin now.
Yeah.
It started me on that.
1 to 10, how bad is the pain?
Oh, it's a 7 right now.
7 or 8. Is it livable?
Nah, not really.
Not really. It really limits you.
Yeah.
Now, I'm going to turn around, show what you got. They got a, what we call laminectomy. They removed that. But the problem is the bad disc. Look at the bone. The disc turned into the bone. So you have reherniation, you have degenerative disc disease, you have what we call even a little bit of a deformity because your spine is bending forward because the bone disc are collapsing. Now we don't want to call any names, but the other surgeon told you need a surgery, but he cannot do it for you. Is that right?
Yeah.
Tell me about it exactly. What did he tell you, and how did he what did he tell you what the options are?
He just said I was too heavy.
Your BMI is 54, so
Yeah,
it is a high BMI.
He said lose at least 200 pounds and come back, and they would fuse my back together, he said, and if not,
So is it, do you think you're able to lose 200 pounds?
like this,
No, you cannot even walk.
no.
So how are you going to lose
No.
weight if you cannot even walk? So it's a sort of catch-22. Which one, you cannot lose weight because you can't walk, and this problem just going to continue. Now, how did you find us? How did you decide to come to us?
I had a friend that called me and watched a commercial and told me.
Yeah, what did he tell you? What
He
did
just
you?
said he saw a commercial, he knew I'd been having a lot of trouble and
Yeah.
stuff, and he said you should check into him.
No, did you check into us what we do and why we
I
can help
just got
you?
the number, and I know it was about 2 months before I called, and after they told me there was nothing I could do, they could do, and I thought, well, I might as well call, see.
Yeah. And that is, you're exactly in a place that we can help you. The reason we can help you and they cannot, and they're true about that this is too risky in an open old-fashioned surgery. That can be a very dangerous surgery because in open-fashioned surgery, even if your weight wasn't this high, that would be 5, 6, 7 hour surgery. But I think we can help you because we do the minimal invasive procedure that can get to the problem much faster and much safer. So we talked about the OLLIF procedure, and we explained it to you why it can help you because we don't cause too much damage to the surrounding tissue, but still a surgery. And we talked about the risk versus benefit. What question do you have for me, especially in your situation, or what would you want to know in relating to this surgery?
If it does work, how long does it usually last for?
Well, if the bone grows together, that's supposed to last forever. But certainly losing weight is a good thing because this is a mechanical problem. But again, we are trying to break this vicious circle that you're too big, you can't walk, and then if you cannot walk, you gain weight. When you gain weight, it puts more mechanical stress. We have to break this vicious circle.
Yeah, and then you can't walk, so then you kind of sit and feel sorry for yourself, and then what do? You
eat more. Yeah, no, I know. This is a vicious circle now. But I think is not a good answer to our patient is just go live with it, because we know most of the people just don't go live with it. It just gets worse and worse. Okay, so that is the purpose of this video, to see that there are options out there. And if you go online, you can get those answers sometimes. Any other comment? Any other thing you wanted to know? Thank you so much. I really appreciate this testimonial.